The Republican plan in the budget they adopted in the House is to block grant Medicaid. It's to reduce the federal dollars for Medicaid. Now, we're saying in the debate here on the Republican side of the aisle, we just can't afford these things. Don't you think the governors are going to say the same thing to people who are going to be permitted to be dropped from insurance coverage under Medicaid? The CAPS amendment would protect seniors and individuals with disabilities. These are people who need nursing home care or home and community-based care. They're not going to get that care under their private insurance. They're not going to get that care at their job in the insurance that's covered while they're employed. This is something that they're eligible for when they are absolutely poor and you don't have private insurance to cover this. Medicaid provides care tailored to meet the needs of this very vulnerable population. For example, Medicaid provides care for activities of daily living, such as dressing, eating, using the toilet, showering. No private insurance, unless it's a long-term care insurance plan, covers that, except in the circumstances where they might be covered for a short-term stay after a hospitalization. 49 states in the District of Columbia have coverage allowing people to live independently. These are the people that the CAPS amendment would protect. The gentleman from Georgia said we want to let the governors in the states be able to count income in a correct manner so that they really are poor enough. Nothing prevents that from happening under existing law. What the Republican proposal is to reduce the maintenance effort now and then reduce the amount of federal dollars for Medicaid next, and then have the governors say, we love you, we care about you, it's so sad that we have no choice. And when these people are dumped from insurance coverage, they have nowhere else to go. They just have nowhere, they have no other options. Private health insurance doesn't cover them, and nursing home care, if they're asking their families to help pay for it, costs $72,000 a year. Assisted living facilities averages $38,000. Home health care services averages $21 an hour. Few people who would be eligible anywhere in this country have that kind of money. It's time to stop this attack on the seniors. And when the gentleman from Georgia says that we want these people who are vulnerable to have less coverage, nothing could be further from the truth. I think that's a statement that is not an accurate statement. These are the people who would be protected if we adopt the CAPS amendment. If we don't, they are standing in line to be the victims of the cuts that are coming down the road. And I have a minute and a half if anybody else wants it. If not, I'll yield it back.